For this PowerPoint presentation, we will be talking about your occupational health and safety. So what is occupational health? Based from the International Labor Organization and the World Health Organization from 1950. It is the promotion and maintenance of the highest levels of physical and mental and social well-being of workers. Occupational health is aimed at promotion and protection of health workers, development and promotion of a healthy and safe work or work environment, enhancement of the physical, mental, and social well-being of workers, enabling workers to conduct socially and economically productive lives, and to contribute positively to sustainable development. So what are your 10 most frequent work-related diseases and injuries in the United States? This is from your WHO. So you have your lung disease, your musculoskeletal injuries, cancer, severe trauma, cardiovascular disorder, reproduction disorder, neurotoxic disorder. You have your noise-related hearing loss also, dermatologic conditions, and psychological strain, and sometimes even boredom. In the slide, you can see the top cases of occupational injuries with workdays lost in establishments here in the Philippines. So this is from a 2019 survey or research. So we have your type of injury, first classification. So of the total 17,762 cases of occupational injuries, open wounds was recorded as the most common type of injury. And then second classification, you have your part of body injured. So due to work-related injuries, wrist and hand are greatly harmed and considered as the most injured part of the victim's body. Next classification, we have your cause of injury. So what is the leading cause of occupational injury in establishments? It is by being caught by or being in between objects. So, yun yung pinaka mataas na percentage ng cause of injury here in the Philippines. Then your next classification is your agent of injury. And machines and equipments or hand tools are the most common type. So, the next one naman, your occupation. So, the classification is occupation. So, among occupations, plant and machine operators and assemblers were the most prone to injuries. So, why do you think ganito yung chart natin here in the Philippines? Yung mga top cases of injuries in the Philippines? Because, uh, Philippines is a third world country, so mostly may mga factories tayo na factories or yung mga blue-collar jobs. So, yung mga medyo dirty work, you have your construction workers, you have your plumbers, yan. So, ang most likely type of injury nila, yung open wounds, yung hands nila, because it is mainly your hands that are doing the work. Yan, being caught by or in between objects. Yan, sa mga usually ito yung sa mga factory workers because they're dealing with machineries. Then, you have your occupation nga, your plant and machine operators and assemblers. In this slide naman, we have your top 3 occupational diseases in establishments in the Philippines, again, from a 2019 research. So first, you have your back pain. Yan, sino dito yung wala pang back pain, di ba? What more when you work na? And then second, you have your neck or shoulder pain. Then third, you have your occupational dermatitis. So, dun sa other presentation natin, we talked about your ergonomic chair. So, that's why mostly in establishments or in the workplace, yun talaga yung recommended. Why? Kasi yun nga, the people who work there or the employees tend to have back pain, yan, neck and shoulder pain also. For occupational dermatitis naman, yan, since we are exposed mostly yan sa labas when we work dahil yung mga madaming work here in the Philippines, usually yung mga construction jobs. So, it is a top 3 occupational disease. In this slide, these are your top 3 industries with occupational diseases and establishments. So, yan. In the first one, you have your manufacturing, and then your administrative and support service activities, and then your human health and social work activities, except public health activities. So workers that are engaged in manufacturing industry or factories had the biggest share of cases with work-related in diseases at 31.8%. So, for this slide naman, you have your number of commuting accident and workers injured in establishments. So, yan. Kita mo, there are 5,899 commuting accidents and 6,170 workers injured for this year. Talk about your terminologies. So first you have your hazard, so anything that has potential to cause harm. Risk, the likelihood that the harm from a particular hazard is realized. Accident, sudden event that results in an undesired outcome such as property damage. Safety naman, the likelihood that the harm from a particular hazard is not realized. What is the difference between hazard and risk? Hazard, ayan. So there's Campylobacter bacteria in raw chicken. So that is a hazard. And yung risk naman niya is yung act of eating undercooked chicken. Ayan. Let's have an example. So, hazard versus risk. So, ito yung example natin. So, MT1 students are having a laboratory experimentation. So, about organic compounds. They are set to test the combustibility property of butane. So, one student lit up an alcohol lamp and placed it directly on a test tube containing the gas without removing the stopper. What is the hazard there? So, the student who irresponsibly lit up an alcohol lamp and performed the procedure improperly. What is the risk? The risk is that the students are would be burned and the laboratory would be set on fire. These are examples of your hazards. So we have your pathogen, animal, or any biological samples, inexperienced individual, irresponsible individual, and untrained individual. Next, we have your risks. An unpleasant outcome or infection, yan, physical injuries, property damage also. Yan yung mga risk na meron. Now we have your accident. So, what are accidents? Yan yung mga accidents. So, di natin inaasahan na mangyari. So, an example is you have a medtech who's drawing blood from a baby and yung baby it's getting he or she's getting malikot, she's being uncontrollable. So, when the syringe was pulled out, suddenly na-prick yung medtech na kumukuha ng blood. So, yan. Yon, accident yon. So here are examples of your health hazards and safety hazards. So under health hazards, you have your physical agents, chemical agents, biological agents, and your ergonomic risk factors. Then for your safety hazards naman, you have your unsafe acts or unsafe conditions. So first health hazard is your air contaminant. So we have different kinds. We have three types. So first you have your particulate contaminant. So examples of these are your dust, fumes, aerosols, mist, and fibers. Then we have your gases. So that's a state of matter that has no fixed shape nor volume. And then we have your vapor. So this is gas or moisture floating around in the air. Health hazard is your chemical hazards. So, these are chemical compounds that induces toxic effects when inhaled or absorbed by the skin or even when ingested. Are the types of chemical hazard. So, ayan, you have to memorize this. Next, we have your biological hazard. So, these are microorganisms and other living organisms that can cause acute and or chronic infections once they enter the body. Of course, you also have your physical hazards. So, examples of that are excessive noise, vibration, illumination, temperature, and ionizing and non-ionizing radiation. We also have your ergonomic hazards. So, ergonomic risk factors are workplace situations that cause wear and tear on the body and can cause injury. So, these include your repetitive movements, awkward posture, forceful motions, stationary position, direct pressure, vibration, and extreme temperature. That's why, again, we have yung mga ergonomic devices or ergonomic furniture to help prevent this. About your health hazard control or the management and control of health hazards. First, we have your occupational hygiene. So this stresses the importance of the following steps in controlling hazards. So first, you have your anticipation, recognition, evaluation, and control. So, anticipation, or the analysis of the workplace. So, it is an essential procedure to help determine the possible sources of potential health problems, to identify exposures, problems, and risks. Next naman, we have your recognition or inspection. So the first step in the actual process leading to evaluation and control. So the best source of directly relevant data about health hazards are the following. So materials and processes that have potential to cause harm, hazards in the workstation. Yan. So yung recognition is yung also inspection of the workplace. What could cause harm? Step is your evaluation. So, this naman is process, yan, yung measurement of exposure and potential exposure. As the word itself, it's the evaluation. So, yung exposure to hazards natin, it's characterized according to your intensity, duration, frequency, and comparison with standards. Lastly, we have your control. So, ito na yung involves the reduction of the environmental stresses to values that the worker can tolerate without health impairment or decrease in productivity. So, yung control, dyan na tayo nagbibigay ng steps on how to minimize the risks or minimize the hazards. So, what are the three methods of control? We have your engineering or your administrative control, and of course your PPE or your personal protective equipment. So the three that we talked about are also known as your OSHA's three lines of defense. So first you have your engineering controls. It eliminates the hazard from the source through engineered controls. Basically, yan. Yun mismo yung ibig niyang sabihin kung ano siya. Then you have your administrative and work practice controls. So this changes the way people work through administrative and work practice controls. Then we also have your personal protective equipment. So to protect yung workers natin. So in this diagram, you can see na it is more effective. Yan. From PPE, admin work, and then your engineering control. Yan yung three line of defense natin. For engineering control, yan, it minimizes the employee's exposure by either removing or reducing the hazard at the source or isolating the worker from the hazard. So, anong example nito? It is yung eliminating toxic chemicals and substituting no toxic ones, or enclosing work processes also, or confining work operations. Also, you have your installation of general and local ventilation system. Yan. So, yan yung mga nakaka-help or yan yung engineering control, health hazard control natin. Your administrative, you have this means that it controls workers' exposure by scheduling production and task or both to minimize exposure levels. So, it speaks for itself, yung meaning niya, yung definition niya, yan. Lastly, we have your PPEs or your personal protective equipment. So, yan yung mga examples natin. You have your hair cap, your lab gown, your mask, yung for other occupations naman na hindi sa laboratory, yung mga workers natin in the construction industry, you have your hard hats or yung mga noise cancellation na headphones when they're drilling, and mga goggles, boots, mga respirators, yan. So, these are all part of your occupational health and safety management and control. Okay? So that's the end of the presentation. I hope you don't have any questions kasi yung mga diniscuss natin or the meaning or the definition ng mga discussion, uh, kung ano yung nakalagay doon, it speaks for itself. That's exactly what it means. Okay? So there's no further analysis or there's no further explanation sa mga na-discuss natin. But again, if you have any question, you can directly message me or you can just ask me or you can comment down dun sa thread natin, dun sa discussion natin sa Canvas. There's no problem with that. So I hope uh, you learned something from it. Okay?